welcome back to my channel, Mental Health with Melissa. I'm Melissa. I am a licensed clinical therapist, a LCSW to be exact, a clinical supervisor, and a PhD psychology research student. I really enjoy teaching, so hopefully these videos are helpful. If you're new here, please do not forget to hit that like and subscribe button for more content. I post videos every single Wednesday and Sunday. Subscribing to my channel really helps me get information out there, mental health information in particular, to our communities of color, and helps further break down that stigma, and also helps me get information out there to those that are interested in the mental health professions. So please, again, like and subscribe, and I will try to get more content out there for you. Today, what we're going to be going over is more information about the LCSW exam, Licensed Clinical Social Worker exam, and I'm going to be doing something a little bit different today. As you can see, I took some information from the ASWB website about the categories that are in the LCSW exam. So as opposed to my regular video going over practice questions, I'm going to be going over the categories and kind of what these categories mean. So if you're interested in watching, please stay tuned. Alrighty, so let's go ahead and get right into it. This is going to be hopefully a fairly short video. I just wanted to go over each of these categories that are going to be on the LCSW exam, because when I was studying for the exam, I gleaned a little bit about what was going to be on the exam, but more so in the form of practice questions. If I had categories that were broken down like this for me, I feel like that would have been a little bit more helpful, but I'm going to go over them today with you. So the first category that is on the LCSW exam, and these are in no particular order. All of the questions on the exam are likely going to just kind of be put out there. I don't believe that they're in any particular order. So we're just going to go through these based on how they were presented on that ASWB website. So human development, diversity, and behavior in the environment. So according to this website, there's 36 of these questions. What is human development, diversity, and behavior in the environment? So what this looks like in the question forms, based on my experience, are really the stages of development theories. So an example of this is Freud. You're going to want to know about the ID, the ego, things of that nature. Another example is Erickson and Mailer. These are all different types of theorists that have to do with stages of development. In addition to that, diversity. So there's going to be questions on there about cultural competency and behavior in the environment. That's more in a line with, again, stages of development and more social science types of questions. So if you are interested in learning more particularly what these questions look like in practice test form, then let me know in the comment section below. I'm happy to do a video on those, as I've done several videos on different types of practice test questions. Okay, so then the next category is assessment, diagnosing, and treatment planning. So there's 45 questions on that according to the ASWB website. Again, this may vary based on state, and also it may vary based on time, because I don't know if they have been changing the amount of questions and how they kind of evenly distribute these questions in the test. So just keep that in mind, and always make sure, as a disclaimer, to follow up with your state guidelines when you're studying. So assessment, diagnosis, and treatment planning is exactly kind of what that sounds like. So I have a couple videos on the DSM and diagnosing questions. So I'm going to leave those in the description box below, so feel free to check that out. So you're going to want to know the different types of criteria and timeline for diagnosing. So when I say criteria and timeline, what I mean by that is, as an example, with major depressive disorder, those symptoms have to be around for at least 2 weeks, 14 days. So if those symptoms are less than, then you can't have, they don't meet the full criteria for major depressive disorder. So that's what I mean when I say timeline and criterion. So you're really going to want to make sure that you study symptomology, diagnosis, treatment planning. This is probably going to be more in line with if somebody is diagnosed with a certain diagnosis, what is going to be an appropriate intervention. How are you going to follow up with a given scenario? What's the best or the first thing that you're going to want to do? So that's what this category looks like. The next category, psychotherapy, clinical interventions, and case management. So this is going to be very similar to what I was describing in treatment planning. The difference is this will probably be more separate from the diagnosis. So you're probably going to get a vignette, and a vignette is a case study or a case presentation about a client or a patient or a family or a couple, and then the question is going to ask you how to intervene or what to do next or what is the best thing to do or the first thing that you need to do. And so you're really going to want to get to know your best and most questions. So I'm going to leave a link for my video that I have on those types of questions down below in the description box, so feel free to take a look at that. The next category is the professional relationships, values, and ethics. So, every state has their testing differences in like the law and ethics exam. For example, in California, social workers are required to take that. So this is kind of in addition to that. So those things that you really studied for the law and ethics, you're going to want to remember them because there's going to be some of those questions here as well. And professional relationships. So there are some questions in the test that ask what to do if there's conflict with a coworker or colleague, or if you notice that a colleague is doing something unethical, how do you address that? Do you report them? What do you do? So I already actually know that answer at the top of my head, but do you know it? So if you don't, you're going to want to study more about that. And if you want a video on that, then again, feel free to leave a comment in the comment section below. And lastly is experimental. So on the test, I'm sure that you probably heard about this, but they like to try out new questions. And so some of those questions do not count towards your overall score. It's just to see if they decide to use those questions. And I think that it is kind of like an odd thing that they do, but it helps them kind of decide if they want to do new types of questions in the exam and kind of how people score on them. So also keep that in mind. So if you have any questions or comments on any of these things, please leave them in the comment section below. And if you have specific comments or requests for any practice exam questions, then let me know what type of practice exam questions you're hoping for me to do videos on, because I do a lot of these practice exam question videos. Until next time, again, please don't forget to hit that like and subscribe button for more content like this. And always remember, managing mental health matters.